The purpose of this video is to present our technique for reinsertion of the tibial spines with double strand lacing of the anterior and posterior bundles of the ACL performed with arthroscopy. This is the case of an active 52-year-old female who presented a direct trauma on her left knee. X-rays and CT scans diagnosed a displaced fracture of the tibial spine. We decided on a surgical treatment for this patient. The patient is placed in a supine position with a knee bent up to 90 degrees, and a tourniquet is used for the arthroscopy. Classical anterolateral and anteromedial pathways are used, and a supplementary superiormedial way will be used to park wires during the arthroscopy. Once the hemarthrosis has been evacuated, the fracture is identified and debrided using the shaver. If needed, the anterior intermeniscal ligament is freed from the fracture. The reducibility of the fragment is tested using the hook. With the spectrum, a first PDS relay is positioned in the posterior bundle of the ACL. Then the first two braided wires, diameter 1, of the same color are tied in their center to the relay wire, then passed with the help of the PDS into the posterior bundle. The same operation is performed in the anterior bundle with a different color for the braided threads to differentiate them when passing through the tibial tunnels. The strands are entangled and then exited through the superiormedial pathway before drilling the tunnels for reinsertion.
Here are a frontal and sagittal anatomical illustrations after passing the 4 strands through the 2 bundles of the ACL.
The 2 central 3 mm guide pins are positioned in the fracture, keeping the wires away and spaced far enough to avoid tunnel convergence. A relay with PDS is entered into the pin tunnels using the AccuFix wire guide, then taken out through the instrumental way in to tie it around the anterior braided wires and guide them down the first 2 tunnels. Then a lateral and a medial pin are positioned on the fracture site, and a relay wire is passed again to recover the strands in the 2 new tunnels.
You can see the result in this drawing once the strands have been passed through the tunnels.
The 2 endo buttons are mounted on the threads, then the reduction is obtained by pulling all strands at the same time and using the hook. The correct tension of the ACL is then checked, as well as a final scopic check.
And here is the illustrated outcome with the endo buttons in place.
These are the last 2 X-rays 12 months post-op. The patient had no pain and a full range of motion.